Hi, this is Dr. Renee Watts, and I got a great question from a patient this week at the office, which was, what type of toothpaste should I be using? And when we go to the toothpaste aisle nowadays at the store, it can be fairly overwhelming. There are a lot of fancy packages with products making a lot of claims. Some of those may very well be substantiated, others maybe not so much. So I thought we'd talk a little bit today about how to choose the product that's going to be best suited for your needs. So in terms of brushing, it's actually the toothbrush that's going to be really getting the plaque off of our teeth and keeping things clean. And so more important than the paste is just going to be taking adequate time and using a good technique when you're brushing your teeth. But with that being said, toothpaste can make it motivating to brush our teeth since we get fresh breath, get rid of any stale aftertastes and things like that. So when you're choosing toothpaste, choose something that you like the taste of, obviously, since you're going to be more likely to use it. You want to try and avoid any products in the toothpaste that are going to increase problems for you, and we'll talk a little bit about some of those. And then if you can choose something that's going to be beneficial for your particular needs, then that's great. So toothpaste all have some common types of ingredients. They're going to have an abrasive component, which is going to help the bristles a little bit, get the plaque off of your teeth. There's going to be some types of sweeteners and flavors in them, of course, oftentimes some type of a foaming agent, and then a binding agent to hold all these components together. Oftentimes there will be other additives, most commonly fluoride, of course, since that's been well established to help reduce cavities. Also other antimicrobial components, sometimes desensitizing agents, extra abrasives to get stains off teeth and provide some type of whitening, or anti-tartar ingredients as well. So we'll talk a little bit about some examples here. This first product is just a basic toothpaste, no special ingredients in it or any other claims. It's just toothpaste with some fluoride in it for cavity protection. And so if you're someone who's been pretty healthy, not having any special needs that you're aware of, you don't have to spend a lot of money to get a good basic toothpaste. And so this is a good example of something like that. Now for people with sensitive teeth, if you've got generalized sensitive teeth and that it's not due to, say, cavities or some other underlying problem, but just sensitivity, we often recommend some type of a sensitivity formula toothpaste to treat these areas. And these pastes will contain all of the above that we talked about, plus some additional components to help reduce sensitivity. There's some mineral salts or some type of amino acids or other components to them. For people with sensitive teeth, we also recommend that they avoid the whitening or tartar control type toothpaste, since these can increase sensitivity in some people. Here is another, just a basic anti-cavity toothpaste. It's got xylitol in it, which is a sugar substitute. It's a sugar alcohol, such as like sorbitol and mannitol, and there's been some evidence that it can help reduce cavities as well. So that's just another example. And then this product is specially formulated for people with dry mouths. So if somebody's got dry mouth due to medications they take or other medical conditions, this product is kind of gentle. It is nice for people with sensitive tissues in their mouth. And it also lacks what we call SLS, or sodium lauryl sulfate, which is a foaming agent that's common in many toothpaste. But for some people, it can increase canker sores. So if you're someone who's susceptible to canker sores, then choosing a product without the SLS may help you have fewer outbreaks of those. So a couple other things just to be aware of. There are a number of natural type products out there, and I think some of those are probably fine. But just be aware that some of the ingredients in those pastes have not been well tested or well documented. And so in terms of claims they're making, they may not be well substantiated. And for some people, some of the components of the natural type paste can also be irritating as well. Some of the essential oils and those other components can irritate people's tissues also. Last, if you're helping children brush their teeth, you just want to make sure that they're able to spit the product out and not swallow it, and that they're old enough to be able to do that. So anyway, I hope these tips have been helpful for you. If you'd like more information, you can click on any of the links below. Thanks for watching.